Let's talk about socially mediated intervention for communication. This is often a topic that is missed actually when we are trying to teach speech and language. And we have to understand that speech and language exists in the milieu of social interaction. So if your client or your child is on the autism spectrum, you would have to help facilitate the social interaction because as per the diagnosis, social interest is not high amongst this population. Of course, there are exceptions. So one of the things that has been researched on this topic is promoting three aspects: mutual attention in play activity. So it's not enough to parallel play. They would have to try to get a peer or a sibling to play together and in a topic that both of them likes. It could be maybe playing outside, kicking a ball back and forth. That's mutual attention. The more that the ASD child does that, the more engaged he or she is in social interaction. And then the next thing after mutual interaction is commenting about ongoing activity. What's he doing? What's she doing? When they are able to see what others are doing, the mirror neuron in the brain will be activated. Mirror neuron deficits in autism has been reported. So what we want to do is to exercise it. The more they do it, the more the mirror neuron will be exercised, right? And you can start with something that they like. If they like cars, get them to comment about cars. If they like animals, get them to comment animals, right? My brother is petting the dog, or my brother is walking the dog, anything like that. The more they comment, if they're not able to speak, they can't point to the picture. They can select on the picture or on the video. They can match the activity with the selection on the video if you do that. And as we said, it's very important to reinforce or to acknowledge the communication of the child and of each other. So let's say you have your child play with the sibling and your ASD child makes the effort and the sibling responded. Get your child to say thank you for the sibling paying attention back and forth, not only acknowledging one party, but both parties. So training implemented with all these 3 points will get you ready for helping them understand that people are there to play with, to comment about, and to feel appreciated. And peer-mediated intervention are taught in the following steps. So in the clinic, this is what we do. We establish mutual attention by moving in front of the child that we are treating. So we move in front of them, and then we may present a toy or another child, and then we're going to ask, what is this? What is the child doing? We can get the child identified. If it's a peer, the name of the peer. They can do it through PACS or augmentative communication system. And if there is no response, we represent the opportunity and then guide or physically guide the child to select the right icon, either on the picture or on the device. And we also, while doing that, tap the child on the shoulder and help the child say his or her name again. So if this child is nonverbal, we do the PECs, we do the augmentative, we tap the child on the shoulder and model the name. And then next, after they have mastered this step, we are ready to go on to point D. Peers will be talking about ongoing activities, watching and listening, and to see if the child takes a turn. So let's say a peer is talking about something, whatever it is that is of interest. See if this ASD child is interested and watch the body language. And if this child starts to show interest, what we can do is we can help engage the child in the group. And we want the child to enjoy being included in the group. Inclusion is an important part of communication. Quite often, the ASD child does not know how to enter a group. So what we want to do is to facilitate the entry of it. The more they practice, the better they are. It's important also to know that they enjoy this. It's not something that they have to do. It's something that is desirable for them. So pick activities that they like, that peers will want to talk about, and reduce the feeling of being daunted because other people are talking and they don't know how to join in. This way, you help them join in the discussion of others. The take-home message here is communication is part of relationship building. Be open-minded. Think of other modalities of communication. Besides the echoics, the PECs, the augmentative communication, there are many other ways. Think of videos. Think of just something tactile, as I said, a model, right? Use anything that speaks to your child. Most of all, use body language. Maybe you can train yourself to turn off the speech and try to understand a movie without any sound. Just watch body language. After that, watch your child's body language. Chances are your nonverbal child may already be communicating to you, but you're not able to understand because you have yet to learn the meaning of the different expression, body language, and all of that. Tantrum actually is also a form of language. Try to listen in and know what that means. So enjoy discovering new ways to communicate with your child. It's like a gift, right? You don't know what's inside. So be patient, learn with your child at his or her pace. Enjoy your child's company. Be hopeful that help is always available. Avoid thinking the worst. What that means is there is a way to get through to your child. Don't think that it cannot be done. You will hear your child's thought. If not today, another day for sure. There are ways. And in fact, one of the things that we do is, in some instance, speech may not be possible, and there are many reasons that give rise to that. If that's the case, if this child has good memory, is able to memorize words, we actually help them select words, convert those words into speech, and have them communicate. It can be done. And proceed confidently and know that slow and steady wins the race. Thank you for listening, and you can reach out to Autism Parent Care. Our phone number is 317-503-1296. Our website is autismparentcare.com. You are welcome to attend our free seminars held each month, and call us. We are always happy to help you hear what your child is saying to you, whatever form it takes. Thank you.